Thanks, everyone. Welcome to this month's webinar. My name is Jen Braun, and I direct the AHA Team Training Program. I hope everyone had a nice start to the year. Welcome to part 2 of our 3-part webinar series that focuses on human-centered design thinking. This webinar is about how to use these design thinking tools to inspire and focus teams. So last month's webinar on applying human-centered design to healthcare is available on demand if you wish to go back and check out the recording. If you did not attend last month's webinar, that's totally okay. You'll still be able to glean a lot from today's webinar. We have our speakers back from DoTank again. So before I hand it off to them, I'm going to go over a few rules of engagement and announcements. And so you can access audio by listening in through your computer speakers or through your phone. If you're having issues, you should be able to access the toolbar at the bottom of your screen to switch to either phone or audio, or phone audio rather, or computer audio, depending on what you're currently using. Please note that you are in a listen-only mode, and all hyperlinks are live, so you can keep that in mind. Finally, I'll moderate a Q&A session at the end with our speakers. So if you have questions, please chat them in throughout the presentation. If it's technical or logistical, we'll certainly answer it in a moment. But if it's for our speakers, we'll save it for the end. And I know both will be monitoring the chat too and can kind of chime in as they're able. So moving on to our continuing education credit, we're happy to offer free CEs for our webinar. So in order to claim your CE credit, you must create a Duke OneLink account. Duke helps supply our CEs. And so this is a one-time only setup. And my colleague Carol will be chatting in those instructions. You can also refer to the email that was sent to you this morning that has some details there. And so following the webinar today, you can you can text the code JAVZUT to the number you see there. And that will happen at the end of the webinar. So we will certainly share this throughout and at the end of the webinar as well. Moving on to some of our upcoming events that I'd like to call out. As I mentioned last month, if you were able to join us, registration for our in-person TeamSTEPPS Master Training courses for the first half of the year are now open. We've made some updates and enhancements to the curriculum to include human-centered design thinking exercises to help participants, lead more strategic conversations, brainstorm some more ideas, and design an impactful change. And so these TeamSTEPPS tools have remained the same, but our updated courses will provide participants more time to collaborate with the teams that they came with and the peers that are there in the course, in addition to walking away with both strategic and tactical plans for how to implement TeamSTEPPS back at their organization. So you'll get to see a preview of some of these design thinking canvases for our TeamSTEPPS courses that our partners at DoTank have helped us design for the course later on in the webinar. But registration is now open, like I said, so please keep in mind that attending in teams is highly, highly encouraged. And we have team discounts, so you can check out the course webpage for more details. If you're looking for a more customized training solution, we do offer on-site trainings where we can come to your organization and deliver anything from a 2-day TeamSTEPPS Master Training course to a more comprehensive training program that spans, multiple on-site visits, where we also do virtual coaching to really truly support your TeamSTEPPS implementation efforts to help you foster ownership and sustainability within your organization. It also allows us to customize the content to really meet your hospital or health system where you're at. So you can visit our webpage to learn more, and you can complete a brief questionnaire where one of our team members will then follow up with you one-on-one to get more information and help tailor a solution. So moving on, finally, our last piece of upcoming events in terms of our webinars is we have one more webinar left led by DoTank in March that will focus on how to craft narratives using human-centered design thinking to better understand your audience and tell a story that is both visually and narratively compelling to help get buy-in and ownership surrounding TeamSTEPPS or any other quality improvement initiative that you're trying to pitch to either your leadership or your peers. So really excited for that last webinar as well. So enough of me. I'm going to now hand things off and introduce Matt Kelly and Adam Colress from DoTank to lead us through our webinar today.
All right, thanks, Jen, and thanks to the AHA for having us, and thanks, folks, whether you're new here or we're at the last webinar, which was a crash course. We went over a lot of material. Today, we're going to really dive deeply, specifically in how you can use design and different tools to really, inspire your teams and to align and move to common action and get things done. So, when we talk about human-centered design, a lot of time, what does that mean, right? So it means what it kind of says on the label. It means when you're designing, it could be processes, products, services, strategies, new ways of doing things. When you're designing something, some kind of change in the world, it's about starting with the human beings. It's about empathizing with people and starting with your audience, understanding what keeps them awake at night, what challenges they have, and then building things that will resonate with their experience. That's what human-centered design is. Now, there's a whole bunch of tools and resources and methods and processes kind of within that, but that's the fundamental philosophy. So that I think is really, really important to remember. So I think, as we kind of move on here, when we talk about human-centered design, we always say if any field should be human-centered, it is healthcare, right? So this is a place where, people are dealing with health and people's lives and, complicated human beings. So we think it's a space that's a really good fit for design work. And so what does that actually kind of mean in this space? Well, for us, it's a combination of a couple different kind of disciplines and ways of working. So we talk about, design thinking, which, as I mentioned, is rooted in empathy and understanding your audience. And that, again, doesn't just apply to the things that you design and build, but it applies to ways of working. And that's what we're really talking about today, is how do you collaborate? How do you have internal partnerships? How do you work with community-based organizations, et cetera, et cetera? It involves storytelling principles, right? So how do you actually engage your audience, right? So when we talk about design, again, it's not just building concrete things or processes. It can be about sharing concepts, right? And understanding your audience doesn't just have to be a patient or a buyer or a customer or anything like that. It can be senior leadership, the people that you're trying to convince of a point of view. So storytelling can sometimes suggest to people something that's light and fluffy, thing you do when you're gathered around a fire and trying to entertain each other. But it really can be the art of persuasion, the art of connecting with your audience and trying to instigate change. So that's something, as Jen mentioned, we're going to go into even deeper in the third webinar in the series next month. And then business model and innovation, right? So doesn't have to be business like, hey, we're trying to build something to make a bunch of money, right? The business model just means, how does something create, deliver, and capture value, right? So a new process, the way that, the oncology ward works, has a business model in the sense of who are the key people, what's the value proposition, what are the different stakeholders that it engages with, what kind of relationships does it have with those stakeholders? What key partners are there? What resources are necessary? So business model innovation really can connect to business units and teams and stuff. It's not just like at the enterprise level. So there's lots of great kind of uses in there. And then moving at pace, right? So it's about a prototyping mindset. It's about validating assumptions and picking things off in pieces and seeing if you're right, rather than building something kind of in the ivory tower, in the lab, waiting till it's perfect and then unleashing it to the world, right? That tends to be slow, and the world around us is changing very quickly. So pace and moving to action is really important. So these are some of the constituent parts of what we mean by, human-centered design, and specifically in healthcare. And as we discussed in the last webinar, it can apply to all kinds of different challenges that can be clinical or administrative or organizational. So in the work that we do, for example, we use these things and apply them all over the place, right? And we talked about that a bit last week. So, check out that webinar if you'd like to see more detail on that. But before we dive into it, we'd like to have just a little reflection moment for yourselves, so that as you're being active listeners here today, we encourage you, as we show you, Adam and I are going to show you all kinds of tools and we're going to talk about stuff. We want you to have a mindset of, what can I use? How might I apply that for my own work? So think of this as more of an applied learning session than just like an abstract, like, oh, I'm just kind of checking some stuff out. So to that end, we'd like to have a 1-minute kind of solo ideation, meditation, whatever you want to call it. And we're asking you to reflect on your own team. What are some of the collective goals? What challenges do you face? What's rough? What works well? What's the culture like? Okay, so we're going to do just a quick solo meditation for people here. So just think about yourself. What makes your team great? What makes your team not so great, right? What really motivates it? When does it thrive? When does it stall? What's the nature of communications? How transparent is your team? How efficient is your team? How energized is your team? What are your team's goals? What are you trying to achieve? What's your mission? Are people aligned to it? Or are folks pulling on the rope in opposite directions? All right, cool. Now that we've all lulled you to sleep with that meditation, no, hopefully not, but keep that kind of picture that you have in your mind going as we advance through the next 45 to 50 minutes. So the content, so there's three basic parts. So we're going to start, and I'll do primarily the first two parts. Adam will jump in with some questions and some additions to what we're talking about. And then Adam's really going to kind of take the wheel for part three. So the first part, we're going to talk about empathy. Again, one of those foundational elements of human-centered design. And how can you use specific tools? We're trying to show you some real tools here that you can download and use with your teams. Some real tools to understand your peers better, and tap into people's superpowers, just be more empathetic and aware of things that, you know, trigger folks or might kind of slow them down. So there's some tools that are really useful to kind of build understanding and alignment, but they can also be really useful management tools. So we'll show you a bit about that. And then team vision and alignment. Hey man, if a team's pulling in different directions and has, you know, very varied understandings of what's the purpose and the mission for the team, you know, that can be very counterproductive. So working collaboratively in a human-centered design way where people can have input and they can question it and try it on for size and see how it feels by working on it together rather than just receiving it as a document from above can be a really powerful team building and team alignment exercise. So we're going to talk about visioning. So a very important thing that sometimes teams don't do. And we're not just going to talk about teams in that we're going to talk about partnerships, right? So many of you on this call here may have been part of, you know, community-based partnerships or partnerships with other departments or, you know, divisions within your organization, things like that. Partnerships, frankly, and we'll get into some greater detail later, a lot of times they fail because they don't get off to a good start, right? You know, chartering, what are the roles? What's our shared vision? How are we going to work together? So we'll talk some practical ways that you can, you know, kind of get those partnerships clear and off to a good start. And then Adam's going to talk about being efficient and specifically high reliability organizations. So we've developed a bunch of tools that help teams really apply some of those principles to their work. So that's kind of the goal. All right. So part one, empathy and creative collaboration. So I mentioned that we're going to really focus on some tools here. So there's a couple of variations of what we call empathy maps. Many of you on the call may have seen these types of things. You may be familiar with them. This one here is a very famous example of one that was developed by Dave Gray, I think when he was with X-Plane. And this is a tool that we use all the time, and so do tons of strategy, innovation teams, firms, et cetera. So an empathy map is really an exercise in trying to understand the point of view and perspective and experience really of a group of people, or it can be on an individual person, right? So when you use these, and we're also going to post a link in the chat where you can download these tools so you can, you know, find them and actually get utility from them. So we have a healthcare innovation hub where everything on it's free. So you can actually download, like, for example, the empathy map and use it with your team. When you do it in person, we'll often print them out of FedEx, you know, like $5 black and white, 3 feet by 2 feet. You can put images of them on a mural or a Miro, you know, a digital whiteboard. There's lots of ways that you can actually use the tool itself. But sometimes we'll sit down as a group of people, and let's say we want to empathize on, you know, a patient population. This will help the team, you know, use Post-it notes, and you'll kind of fill in the spaces. Think through, what are they really experiencing? You know, what are they hearing from colleagues, families, peers? What are they saying? You know, what do we observe their actions being? And again, an exercise like this really helps you root yourself in who are the people we're serving. Right? It's often an impulse for folks to start with what they're good at, right? And what their strategic objectives are and what they need to achieve, right? Rather than starting with who are we serving and how can we center and root our work in those people. So it might sound obvious, but it's a perspective and a step in the process that is often skipped. You know, people run with the assumption of, oh, we work with these people every day, we understand them, right? But when you're doing an exercise like this, it's also important to know that what you have here is fraught with assumptions. So a next step in this kind of innovation process, if you will, is to validate assumptions. So to actually then go and talk to people, whoever the stakeholder group is that you're thinking about, and see if you're right. Another thing you can do, and this kind of cuts to the chase a bit, is you can use a tool like this almost as a quasi tool for focus groups. And we'll talk about this a little more later. Put it on the table, invite those stakeholders into the room and have them fill it out, right? So empathy maps, there's a lot of utility to them, right? So they can help you understand others. They can help you understand individual people, segments, etc. And they come in a couple of different versions. So you can see pains and gains in the center. Oh, sorry. On the outside, you have kind of like this cognitive experience wheel. In the center, what does it distill down to in terms of what keeps them awake at night? What do they dream about? Sometimes you'll see a version like this, you know, jobs to be done is what are people trying to achieve? These can be social, emotional, personal jobs, not just like jobs on the job description, but they're trying to gain status or friendship or support, whatever it might be. But to really think about what they're trying to achieve in their day-to-day lives. Pains, what risks do they observe in the world? What obstacles they have to deal with? What keeps them awake at night, if you will? In gains, what would exceed expectations? What would be kind of incredible? So doing exercises like this, even in a more simplified version like you see here, can really lead to greater insights and a better grounding, you know, in real people, in the work that you do and the stuff that you design. So I'll go into this one here in a little greater detail, because this is kind of a fun example, right? So this is a persona canvas. You'll see a lot of the, you know, kind of things that you saw in the previous two articulated here. But sometimes, you know, we'll do this actually in one-on-one exercises, and I'll show you some pictures of that in a bit, where we'll put people in pairs and give them each one, and they have to draw a portrait of the other person. So a great team building exercise, right, is let's say you get 10 people, create 5 pairs of 2, and let's say it was me and Adam were a pair. I would interview him and I would fill this out and almost create a picture of Adam's world based on, you know, talking to him. So it's a great way to use, and we say this about all these design canvases, there's simple structures to hold complex conversations. That's what they are. And we're going to show you a bunch of canvases today because they're really useful in the human-centered design sprinting kind of space. So you start, you can draw, you can have fun. If you do this though, one word of caution, use Crayola washable markers, not the permanent ones. Otherwise you may end up marking up your walls or tables. But anyway, facilitator tip from experience. But anyway, you can start, you can draw things. Sometimes we had people like draw capes or like monocles that kind of like what they draw actually symbolizes something about that person's job or their personality, you know, identify them, etc. And then what you're doing is you're just kind of following through the canvas. So negative trends is, what does this person observe around them, right? Describing their environment. They're seeing what's impacting them, you know, in the broader context in a negative way. And then on the flip side, in a positive way, where there are opportunities for improvement, for growth, etc. You know, headaches is a little bit less of the broader macro context and really focusing on like, okay, in their job, at work, you know, where are they really struggling, you know, where are opportunities for their professional life to improve. And this could be true of, you know, again, it's still at a somewhat broad level of other people with the same job description, right? So it's like, you know, all nurses in this department kind of experience these headaches or, you know, these opportunities. But in this case with Bob, particularly with Bob, what does he fear? You know, what does he worry about? What keeps him awake at night? And what does he dream about? What would be fantastic? So again, at the philosophical level, empathy is essential core of human-centered design. You know, you start with the people that you serve, the stakeholders that you're trying to create value for, and understand them, validate assumptions, talk to them, and then hopefully what you design and build will resonate better with them and provide more value for their experience. At a high level, that's the fundamental takeaway. What we're showing you here are a few tools to help you get to that deeper empathy in a fun and engaging way. So finally, the heart, you know, what sums it up, what really drives this person, what motivates them. So here you can see an example of one kind of in action here. So this is a really great project that we did with a community health center in Milwaukee. And we paired people up, just as I mentioned, and people drew portraits of each other. So I mentioned printing these things at FedEx. You can also draw them on flip chart paper, right? That's probably the easiest, most accessible way. These are simple things to just kind of sketch out. And you know what? Maybe some of you on the call are thinking, I don't know that. I can't draw. I hate drawing. I'm not an artist. I always encounter that when we run workshops. Don't worry about it. The quote unquote bad drawings are way more entertaining and fun than the good ones. And you do this and you realize that the drawing is just a means of visual communication. It's fun. It's rare that you're in a room where everyone's a Picasso and you're the odd person out, right? So don't worry about the drawing. It can actually be a lot of fun. But here you see an example of it in action. And what we did is after the people on the team, drew each other's portraits, then they did a presentation. So then they told a mini biography in a few minutes about the person to the other people in the room. And there was a bunch of laughs and it was great. So a wonderful way to also kick off any strategy workshop, any retreat, anything like that. It lightens the mood. It reminds people who are in the room, and it sets a tone of like what they might be worried about or what they're hoping to achieve, not just in the next few days, however long your engagement is, but in the indefinite future. So empathy mapping, really wonderful tool. And just a few kind of other tips about how you can use this to build alignment and understanding amongst your team. The topic for today is as a management tool. So we've actually, seen it done where in let's say you have an annual review, right? Bring the person in, visualize the conversation. So, I'm with Jill, right? Whoever, right? What keeps you awake at night? What are you worried about? What opportunities do you see? You work in this place every day. You see things that I don't, right? So it can break the dynamic of just sitting across the desk from somebody or sitting on a Zoom from somebody and just asking questions and taking things down. So if you're looking for ways to kind of energize and enliven the dynamic of kind of management reviews and interactions, these can be amazing. Have people actually kind of, fill it out for you, if you will. They can be really useful for focus group sessions, right? So you could have, let's say you've got 25 community members coming in because you want to understand them better. Put them in 5 groups of 5 and put one of these things in the center of the table and have them fill it out, right? So they're telling you what they're looking for, where their challenges are, et cetera, et cetera. So every post-it note or everything that's written down is a data point. So if you've got a project where you're trying to learn about your own team or external group of people, this can be a really useful way to capture data and insights on folks. And they're really useful to prepare for presentations, right? So, and we'll talk more about this in the storytelling session next month. Your story, your pitch, your message is going to change and adjust depending on who the audience is. The way that you present a concept to a group of senior leaders is probably going to be different in some ways, the way that you might present that group to an external partner or, your idea to an external partner. So we'll often do an empathy map on the audience before building a deck or preparing to do a presentation, just to understand what do they care about? What content needs to be in here because they're really going to be looking out for it and listening for it. So it's a really useful way to do that. I'll tell you a quick anecdote. We were working with a client one time and we were preparing for a pitch from a kind of innovation group to a senior vice president. And we were thinking about, we'll call him Bob. We were thinking about what keeps Bob awake at night. What does he care about? What needs to be there? And Bob was walking down the hall. And we were actually pretty bold. And we said, hey, Bob, come on in here. And I was going to seem crazy because Bob looks at the wall and was like, what? What are you doing around me here? And we actually validated our assumptions about Bob in real time. And he looked at the persona map and he said, you're right. I do think that. That really worries me. I'm surprised you put that there. That doesn't cross my mind. That's not really an issue. And in like 3 minutes, we were able to validate assumptions and get a deeper understanding about what really mattered to Bob. And then we use those insights to craft the things that we designed, right? And this, again, can apply in any setting, right? It can be clinical setting, et cetera. If you're trying to understand an audience, you can use this to try to actually validate assumptions and whatnot. So, okay, so kind of a fast fly through there. Adam, I'm going to pause there for a second. Are there any key questions, anything I missed, anything that you'd add before we move on?
I don't think so, Matt. And nothing has popped up yet pertaining to your stuff in the chat. So I'm just managing that. But no, I think you've hit leg 1 of the race. And
all right, off to part 2. I'll try to be a little quicker here. But cool. So team vision and alignment. So as we mentioned in the introduction, it's really important that a team has a shared North Star. And it's not just about saying, hey, team, look at this one pager, here's the North Star you need to follow. The way that you build it, the process of building that alignment, that vision can actually lead to alignment. So it's not just about giving it to people, it's about how you build it, right? And a tool that we use, and this is a pretty famous tool, there's a group called The Grove. They've been pioneers in some of this design thinking and design tools. But again, it's on our hub, you can download it, called the 5 Bold Steps Vision. So I'll just kind of go through this quickly. I'll just take you, how do you build kind of a shared vision with your team? Well, you start, one thing that does help, I'd say before this, and it's not on the slide, is to give it a time horizon, really, because this is an exercise in imagining what the future could look like. So sometimes it's helpful to say it's the year 2025, right? Or the year 2030, just depending on how far in the future you want to dream and imagine. And the vision statement is kind of what's the summation of the change that you want to influence and what you want to achieve in the world. Teams, just a facilitation caution here, teams can really get lost in the weeds of wordsmithing here. Don't worry about that too much. It's just trying to get the fundamental heart of what you're trying to achieve. So it could be like, by 2025, we want to be the preeminent cancer hospital in the Midwest. We want to, with customer satisfaction rates that exceed that of all of our competitors, right? I don't know, I literally just improvised that and made it up, right? So whatever it is, it's that kind of fundamental dream. And then the themes are the detail, right? So example of themes could be like, what are our ambitions by year X around, it could be anything like the diversity and makeup of our team, right? It could be what kind of change do we want to make in terms of reduction of harms? What kind of change do we want to make by that point in time in terms of financial performance? Geographical footprint, like if you're trying to grow a business, right? So whatever it might be, you're adding detail to the story. So, but by doing this with a group of people, this helps you keep the conversation efficient. So it's not just people waiting in line to talk, as we like to say, but by putting things down, the team can share ideas. And, you know, Adam can be like, hey, I have a dream that by 2025, we do this. And then it's open for discussion. And I could say, I like the idea and the sentiment, but is that the right number? Are we being bold enough? Do we want to have a greater metric? See, so it helps guide discussion. And by discussing it, people, this is key, people understand the vision better and they have a sense of ownership. And when you have those two things, you're more likely to have buy-in and real kind of investment in doing things together, right? So by building it together, you're trying it on, you're struggling with it, and that yields a greater understanding. And by letting people contribute to it, they feel like, hey, I see myself in that, I'm connected to it, right? So these are kind of some other benefits. So hopefully you get a better vision and better product, but I think you get a better kind of team investment in what you're doing. So anyway, brief digression there. The bold steps are, what are you going to do in an effort to achieve that vision? So what are the action items? So we fundamentally have to change something about our behavior, our resourcing, our investment, whatever it might be, in order to achieve this ambition that we've lined up. And along the way, what's going to support us? Oh, we have incredible leadership buy-in. We happen to be working on a topic that is really high in the agenda of, you know, prominent topics in our state right now, whatever it might be. You're thinking about, these are the things that we can leverage in an effort to reach our vision. And the challenge are things like, hey guys, we got to be aware of these things. We got to proactively overcome them, right? So these are the things that are in the broader context that are going to help and slow you down. And being aware of them will help you plan around them and hopefully, you know, make best use of the supports and overcome the obstacles. This is what it looks like. Again, an example from the great project that we're doing with 16th Street. So after we did some empathy mapping, people warmed up. There were other exercises that we did, but amongst them was kind of building what could this vision look like. And when you've got a team that's more than a handful of folks, you're going to have to break people out into groups. So then you have a job. Okay, we've got all these different visions. Hopefully there's overlap. If the visions are radically different from each other and it's on the same team, that tells you something else. But hopefully there's some overlap. Then you have a job of kind of synthesizing them and bringing them together. And when you bring them together into a vision, then it becomes something that's recorded, and then you can use it as a management tool. You can actually revisit it, show it to your team, you know, see if you're still making progress, etc. We always say about conceptual things like a vision or a strategic plan, that you should test them just like you would a new product, service, or process. So you take that first draft vision and treat it as a prototype. So you might then show that and share that with senior leaders, other groups, et cetera, and get their feedback. What do they like? What do they dislike? What's missing? What's confusing, right? So treat your vision the same way you would as a new product or service, in the sense of testing it, right? And if you have like an extended audience, it's another way to get people feel like they're engaging with it and having some input, right? So they might not be within that core team, but they're still part of the broader diaspora of people that are working on this thing. And by testing it, you're actually inviting them in. If you're going to do it at scale, and this kind of extension of segmenting, of the idea of testing, you want to segment your audience, right? So again, you have like a core team that might build it, and then you've got like a broader group, and they become like you can call them a reactor panel or the test population, whatever it might be, but you'll give them a different job to do in the vision creation process. And then you can use this to really drill down into the next level of kind of personal accountability, right? So are the OKRs, whatever KPIs, whatever acronym or method that you use in your organization to, look at people's performance and seeing how they're doing and is it aligned with strategic goals. This can become that kind of shared North Star that, again, people have helped build and hopefully feel more invested in. So then their personal contribution to it, when you get to that level of detail, it should align with that. So it's a great kind of communal start to then go into more kind of individual contributions. Okay, and then real quick, I mentioned that it's not just about internal teams, it's about community-based partnerships as well. So I'll go through this real quick. There's a set of tools that we actually built with the Montana Healthy Communities group. And this is to help spark healthy and successful community-based partnerships. We do a lot of work in this kind of space. We've got another whole set of 10 different tools that incorporates like power dynamics amongst partners and all kinds of other things with the Build Health Coalition, but that's coming out later this summer, so we can't share it now. Anyway, sorry, I digress. But we do a lot of work in this space, and something I've seen is that a lot of partnerships fail, and I mentioned this at the beginning, because people get together and they just start doing stuff. They don't take an inventory of like, who has the different relationships that we can leverage here? What are the different roles? Even things as like detailed as, who's going to set our appointments? What's our meeting cadence? Like being very clear in the beginning about how you're going to work together. And then all these other parts, like the visioning, understanding our customers, et cetera. So just kind of bringing it back, we, created a variation of an empathy map that was kind of rooted in the community work that people were doing. Who are we serving here? Like this partnership has been created for who? Like what are these people that we're trying to, influence and create value for? Do we understand them? And are we aligned? Because if you have like a partnership between like a community-based organization and a health system, they might have very different perspectives on what's happening in the communities around them. So having conversations to really share ideas and insights and align on that fundamental understanding of who you're serving, especially when you're in different organizations, it's so important. And unfortunately, it's a step that's skipped so often. So we really encourage that. And then not just understanding the individuals and the folks in the community, but what are some of the broader trends that are impacting, the community in the area that you're trying to work with, right? So just being aware of these things so that, again, you can overcome them if there are obstacles, but take advantage of them if they're good things. Like if you see trends around funding, highlight them early on, and that might influence, we should apply for grant, this, that sort of thing, right? Visioning, again, it's essential. There's a variation on the bold steps, just a little more detail that are community partnership specific. So what are our shared financial goals? How will this partnership be sustainable? Who are we trying to impact? What's the time frames on it? That kind of thing. Resource mapping. Again, for the sake of time, I won't go into great detail. You can learn more about this on the hub if you'd like to. And then game planning is really getting down to task orientation, project management, and moving to action. Because another thing that happens a lot with partnerships, people, for obvious reasons, get very distracted by the needs of who's paying them, their home organization, right? So it's easy for partnerships to lose momentum. So being very clear about not just what tasks are coming next, but who's responsible for them is critical. So again, something that we've seen in the community-based partnerships. But one thing that we didn't see a canvas for there, although they do exist, was the thing I mentioned earlier about chartering. Being very clear early on about roles, who's doing what is very, very important. And that's what a lot of this stuff that we've talked about, like visioning, inspiring teams, understanding stakeholders, it's in the TeamSTEPPS program. So we've had the great privilege of working with Jen and the team to help introduce some new design tools. So, here's a little, kind of plug and preview. Really check out the TeamSTEPPS stuff if you haven't already. And if you have before, there's some new stuff. So if you haven't taken a course or seen it in a year or something, you might be surprised at some of the new design elements. So anyway, a little plug for that. We've actually worked with the HA and partnered with them to design and build some new tools. So anyway, just wanted to give a shout to that. So thank you for listening to me. With that, you're going to now listen to Adam for a little bit. So Adam, with that, are there any things you'd like to add or questions as we transition to the final case here?
Matt, there's been some great activity in the chat that I'll encourage you to take a look at as I'm doing my case study, because I think there's a couple of things in there that would be really good for us to discuss with the group. If you don't mind me sharing my screen, Matt,
Absolutely.
I'll go ahead and do that.
I will stop sharing.
Yeah, but really appreciate the dialogue that folks are creating within the chat. How does that look, Matt? Am I full screen and shared?
Yeah. Cool.
All right, folks. So let's see. We've got 12:37. I want to take some time to do a little bit of a deeper dive. I think Matt did a great job of showing and demonstrating how we can try and coalesce around empathy and visioning and strategic action with groups through very different modalities and different tools. And so what I'm going to share with you is more of a case study, a sharp little vignette of how we're applying those principles of trying to get teams to focus on a really tough, big problem and also inspire them and ensure that there's empathy throughout that process. In the case study that I'm going to share with you, and we've got many like this, but I pick high reliability because high reliability for many is just a buzzword. For some of us who've had the privilege or the challenge of working in this space, you can find that it's very difficult to translate sometimes into an organization because it's big, it's so ivory tower. And so what I'm going to talk about is how we're attempting to integrate high reliability thinking and principles into organizations through human-centered design. And so this case study is really going to focus on the tools that we're using within our high reliability approach that help teams focus on big abstract initiatives like high reliability. Think about things like clinician well-being or behavioral health or population health or health equity, all of these things that necessitate teams and committees and cross-departmental collaboration. Any problems like that, we find are our sweet spot. And so the more complex, the easier it is for us in a way to apply simple structures to hold those complex conversations and work with teams over time. So as I walk through this example, all the tools that I'm going to demonstrate to you here, there's only one that's really unique to high reliability. They're all available for download, and you could all apply them to different strategic areas, those big kind of hairy, gnarly things that you might be trying to tackle. So I had the privilege of working with a few different states and with the Joint Commission for 2 years to help roll out their high reliability platform, which is called the ORO assessment. It's a great assessment, and it's probably the Cadillac version of a high reliability assessment that's out there in the market. And so we worked with over 50 hospitals in a few states to roll out that assessment and then try to move those organizations to action. What I found in doing that work, and there's kind of 4 bullet points here that were like pebbles in my shoe or things that we learned as we were trying to translate such a big concept and embed it in the culture of an organization that we wanted to solve for as we move forward. The first was, having a skill set that can facilitate open conversations was critical. So being that individual or having a team lead that could help move folks along. We found that teams who had good facilitation and a really good team lead, they moved much quicker into that high reliability space. And one of the things that we're trying to solve for there through human-centered design is taking that need or that imperative skill set away and applying it to the canvases that are in front of folks so that we're building that consensus. And that's been really illuminating and fun to see. Leadership, commitment, involvement is always imperative, regardless of if it's high reliability or whatever the initiative is. But we found that we took too much of a top-down approach. And so finding different strategies and ways to incorporate the bottom-up voice into a high reliability movement was critical. And so that's something I'll demonstrate to you here through the slides I'll go through. And then the executive teams that we're working with, it was one thing to have a good assessment process and to really dive deep into a problem. But if you spent 80% of your time just on that piece and pontificating and getting feedback and finding out what the problem was, if you didn't have that nice pathway to move to action, it just was going to be one of those initiatives that felt like it was the flavor of the month to people, or something that was rolled out, but then where was the activity or the action that translated to it? So we wanted to ensure with this approach that we're taking that concrete action and pragmatic steps towards the end goal were as paramount almost as the assessment process itself. And the common theme that we ran into over the course of those 2 years was accountability and focus. At the end of the day, there's these 5 principles within high reliability that are on this slide, and that many of you may know very well. But at the end of the day, it was trying to connect accountability and focus to those things with individuals. So it's something that was done alongside their job and what they already had to do. Basically, a new set of lenses to look at problems through, as opposed to a new initiative or a new platform that you had to plug kind of inputs and outcomes into. So with that said, this is the vignette that I want to tee up to you. We worked with a state hospital association and then a critical access hospital network this summer with a cohort of several critical access hospitals. And we had 5 main steps. We wanted to first identify issues that mattered to them, and then call out the factors that were contributing to those issues, and then help those organizations look at those issues through a high reliability lens using our human-centered design tools. So then they could define and kind of put a quality improvement spin around how they could start to solve for those problems. And so what's different about our approach to others, whether it's high reliability or equity or whatever it may be, I think there's a philosophical belief that we have that you don't need to put people through 20 hours of competency or webinars to get a concept in their head before they can then start to apply that theory to action. So we skip that step by designing the competency into the visual tools that you're using. So there's 4 tools that we used along this journey, and I'm going to preview each one of these for you guys and give you a sneak peek of them. And again, these are all ready for download and super applicable things that you could start using with your teams today. But we did the Swiss cheese model. I'll talk through the high reliability canvas, then the improvement canvas, and finally the game plan canvas. And all of this is on that arc of moving from inspiring a team, creating focus, and then driving them to action. So the Swiss cheese model, some folks might know about, and I'll digress here just for a second. If you haven't heard of the Swiss cheese model, it's a James Reason's kind of logic model that's applied a lot in quality improvement. Basic premise is this: when something goes wrong in healthcare, it's usually not one thing that happened to make that adverse event or that bad outcome come to light. There's probably a lot of systematic things that broke down and a lot of factors that led to that fall or that wrong site surgery or that readmitted patient or whatever it may be. And so with the Swiss cheese model, the premise is when something bad happens, what are those different barriers of defense or those layers where there was a hole in the process and something went wrong? And if we could say, ooh, if we just plug the holes in this layer, this adverse event wouldn't have happened. And so we have a lot of fun taking these concepts that people have been trained on or that you hear about and translating them into like really fun visual canvases to get folks engaged in. And so if you didn't know about the Swiss cheese model now, and if my previous example didn't really nail it for you, this is one that everybody's lived through for the past few years, right? Adverse event, getting COVID. What are the barriers of the defense that we can do as individuals to prevent ourselves from getting COVID? We can wash our hands, we can wear a mask, we can socially distance, we can avoid large gatherings. And at every piece of those barriers of defense, when we don't do one, there's a higher likelihood that we could get COVID. And so it's, again, just plugging those holes and ensuring that we're doing all those things to avoid a bad outcome. And so here's some tangible examples. And we had a question in the chat about how we do this stuff through virtual formats like Zoom. Everything I'm showing you here, these are actual mural canvases. So we did all this work, Matt and I, totally virtual. This was a design sprint that we did with several hospitals over a couple months, and we never met in person. We never sat around a canvas and did Post-its. We did this all virtually. And so Mural is a great tool. Miro, Jamboard. I know some folks have been jotting stuff in there. But keep that in mind as I show these examples. So this is stuff that you guys could kind of prop up on your own, if you will. But we had teams here, just a couple examples of this Swiss cheese model. This one team was focused on burnout, clinician burnout. That was their big issue. And we challenged them to say, okay, put your big issue that you want to focus on at the end of the table here. And then what are the biggest layers of defense that break down, which contribute to burnout? This particular team said communication, they said recruitment, retention, and then environmental issues. And then you can see some of their Post-its they put up. And so these were things that were putting holes in the cheese and that were contributing to that sense of burnout. So this is a really cool exercise, from a root cause analysis perspective too. If you have teams where something went wrong, just using this as a platform for discussion, putting that event, whatever it may be, or that breakdown that happened within your team, and just holding a 30-minute conversation around, okay, what are the big things that led to that happening? And what are the little micro things that broke the barriers of defense there? So burnout was one of the issues that a team focused on. Staffing was another one. Again, this team dug into, marketing, location, being a really critical or really rural critical access hospital, and the Great Resignation as things that were really contributing to the staffing issues that they were facing. So that's what we did with teams first in this high reliability process, was give them some space to empathize, to inspire a little bit around the problems and coalesce around them and get to a spot where they were saying, this is the issue that we want to focus on more. So then we moved into our high reliability campus. And this one has two parts. There's kind of this cloud to the left, and then to the right are those principles of high reliability and those lenses. And the first thing we do before diving into that is we challenge organizations to say, put your big issue in the middle. So you may have a very macro goal like clinician burnout or staffing that you focus on with the Swiss cheese, but now put an area of opportunity that's really tangible that we could work on at the middle. And so some of the organizations, this was the first part of their campus. We had somebody focusing on arrival experience. We had an OR team that was focused, and then an IT team. And you can see some of the current state things. What we tell them to do here is put your problem in the middle and then just start ideating around those issues, very similar to the Swiss cheese model, that contribute to that area not optimally performing. So this OR team was saying they have low surgical volumes. They don't have a strong OR manager. Scheduling is an issue. So we're just giving them a chance to kind of brainstorm, dump all the bad things out on the table. And that's kind of the first part of the high reliability assessment itself. And then what we're challenging them to do, and this takes place over several hours and several different sessions, is we try and connect the dots between those issues and challenging yourself to think of them through a high reliability lens. And so this arrival experience team, for example, one of the things that they really cited was there's not a consistent experience here. So different folks, different patients who come in, they have a totally different arrival experience depending on the door they come in, the doc they're working with, the app they're looking at or not looking at. And so preoccupation with failure is a high reliability principle that really struck them with this particular problem. And what we've got baked into the canvas are different leading questions around the 5 different principles there. So you can see a lot of type and text there, but these are, again, lenses for people to think about how could we approach this problem a little bit differently. Another issue here was with the arrival experience, we found that it was designed in a very non-patient centric way. And so they were really focused on, from a reluctance to simplify perspective, let's stop making this just a simple process and let's dig in and challenge ourselves, get some patients in here, get some focus grouping going on, and figure out how we can make this experience more patient-centric.
Hey, Adam,
so that's
I'm going to jump in real quick. There's a question in the chat. I know you can't see the chat, but Robert had a question about the HRO observation slide. The accountability piece is a really tough one to achieve. So can you talk about that a bit? How do you then take some of these observations and then make accountabilities, et cetera?
Yeah, and I don't just mean this from the facilitation perspective, but like you'll see that in a few
That's
slides.
where this comes in. That's right. Okay, right.
Yeah. Yeah, so that first part again, it's around empathy, it's around some focus and some inspiration, but this is where you start to get to focus and accountability. And this was the piece, Robert, that in the 2 years with Joint Commission and other assessments, I found it really tough. It's really easy for folks to sit around a table and moan and have that session and say, oh, this is all that's bad with the world, and if we could change it. But it's really tough to then get groups to say, okay, we consensed around this. Okay, where's the rubber going to meet the road? And so these next two canvases I'm going to show you get to the accountability and where the rubber meets the road after a team has said, yes, this is our problem. These are the factors contributing to it, and this is how we should approach it. So once we do that over several sessions with those two canvases, once we get that consensus and that buy-in and that focused approach, this is where we start to work on accountability. And it's through starting with this improvement canvas. The improvement canvas itself is the model for improvement, that if you've done Lean or Six Sigma or DMAIC or any of those methodologies, you know the model for improvement. It starts with an aim statement. How are we going to measure change? What are we going to do differently to ensure we reach our aim? And so we take those micro Post-it notes and we put them through this process where we're challenging teams to have explicit aim statements, explicit data points, and then explicit action steps and ideas of what they're going to do differently to solve for a problem. And so with that burnout group, one of the things they focused on was employee morale. And you can see here, I won't go through all of this for the sake of time, but this was a whole session. I took the team names out of this, so they're not here on the left, but this is where accountability starts. So you'll have several of these improvement canvases and game plans, and teams are going to see exactly what they need to do to move in a direction here. So this was one of the micro projects that came out of that burnout group, and it was assessing employee morale for their organization, having 75% of folks take an assessment and having leadership analysis within 6 weeks. And so we start them by literally like spelling out box by box, what's your aim? What do you want to achieve? How are you going to measure it? And then what are those things that you're going to do to ensure that this aim statement of an employee morale assessment going out in 6 weeks happens? We ideate around what they've done before in this space, what supports barriers might be, what their scope is. So this improvement canvas is kind of your charter, right? After you've got your empathy, your focus, and then this is where the real accountability comes to play. After you have an improvement canvas and a charter set, this is where we graphic game plan it out. And we say, okay, in the next 8 weeks, what is Susan going to do? What is Martha going to do? What is Becky going to do? What supports do they need? What are their challenges? What's that idea that we're executing? And so here's, we put the staff survey at the end of that target. And then we move through those phases. And I redid the color logic here, but this is great for color logic if you're in Mural. So Susan might have a pink Post-it. Martha's got a purple one. Becky has a black one. And then as you go through, it's visually very apparent what steps kind of color assignment wise individuals need to take as you progress towards executing that all staff survey. So that's the piece where we really get to that accountability and spelling it out. So I know that was super quick and that was a lot, but again, I think we're hoping that we give you guys an idea of not just theory here and concept, but then of how you could print this stuff off and start to apply it and start to think through it. So that's our kind of the end of my vignette or case study on high reliability and focus using some of those tools. But I want to move rapidly through the rapid replay to see if we can dive into chat, if there's more areas that y'all would like to discuss in the last 5 minutes. But these slides here just are quick hitters of these values that we believe human-centered design can bring to the healthcare space from an equity, burnout, kind of a quality improvement perspective for sure. And so you don't need to see any more of us. I do want to pause and see if Car or Jen, if we want to touch on any of these reminders before we open it up to the floor.
Go ahead, Matt.
Oh, I was just going to say, and then the floor is yours, Jen. We've tried to answer questions in the chat, so I don't think we'll have time for a lot of verbal questions, but Adam and I have been furiously typing away in there. There were some questions we didn't get to, like Rachel, you had a question about like facilitation details. We really sincerely do encourage you guys to email us. Obviously, it's a short period of time, so if you have specific questions about facilitation tips or anything like that, just give a shout. So we posted our email addresses there. But with that, over to you, Jen. Any big questions burning for you, or take it away?
I'm just going to do a quick final reminders, and then maybe we'll close out with perhaps a preview for the next webinar. I think might be good. So Adam, I'm going to put you on the spot here in a second. So I'll give you a quick heads up. But for the evaluation, just know that once we close out the webinar for today, an evaluation form will pop up on your screen. So we would very much appreciate you taking a moment to fill that out. Your feedback is super valuable. And then finally, for continuing education credit, you may text that number you see on the screen and text the code JAVZUT to claim your CE credit. So just wanted to get those kind of housekeeping items under the way. And so kind of given that we only have 3 minutes left, you know, I think a lot of the questions were, or this presentation was great because it was really practical. We saw how the tools could be utilized and the benefits and outcomes out of these canvases and tools. But from like a facilitation perspective, yeah, I think a lot of people had questions. So Adam, for the next webinar, I know you guys are going to focus on storytelling, and participants of that webinar will actually get to go through some of these design thinking exercises, correct?
They will. And let me put out a 2-minute challenge to everybody who's still listening and who's still out there. In a very human-centered way, well, we are totally going to focus on storytelling next time, and I'll talk about that. But I would love for y'all to chat in. What are some of those things that Matt and I sparked in this session or in last session that you might want to hear a little bit more theory or content from us on? I think, I forget whose name it was, but there was a great comment in there about, you know, are folks hesitant to do this? Do they dive in or not? And I'm like, oh yeah, there's a lot I could say on that. So and even facilitation tips, stuff like that, because in our next session, Alex and I can absolutely take, you know, a little bit of time to address some of those things that might be sparking more interest for you guys. So feel free to chat that stuff in now. We'll catalog it all and integrate as much as we can into next time. But next time is going to be about storytelling. One of those core tenets of the 4 things that we integrate into human-centered design within healthcare. And it's such an important skill set. And there's a macro focus that we'll take you through, which is basically when you're pitching or telling any stories, ensuring that we're speaking to the head, the heart, and the eyes. And so ensuring that when you're working with groups of people, internal stakeholders or external, and trying to sell or pitch your idea or your thing or get buy-in to what you're doing, that you're doing it in a human-centered way, and you're approaching the head, heart, and the eyes of your audience. And so we'll take you through a process there that you can apply to any of your internal or external pitches next time. And then we'll be happy to integrate any other comments that you guys are chatting in now. Matt?
Yes. So the participants will get to go through the experience, right? They'll get to, so I think it'll be a good lens to come at next month's webinar with the student hat. You know, I'm going to, you know, participate. I'm going to apply these tools or these skill set to whatever quality improvement TeamSTEPPS thing you're trying to pitch or, you know, communicate to external or internal stakeholders, but also kind of taking that facilitator hat on as well and looking and observing how Adam, you and Alex will facilitate these exercises.
Yeah.
So, all right, we are at the top of the hour, so I do want to be respectful of everyone's time. Just taking a glance at the chat, it sounds like everyone was pretty jazzed and appreciative of all of the information and tools, Matt, that you and Adam both shared. So thank you so much. We really appreciate our partnership with Do Tank and all the work you guys have done to help us enhance the TeamSTEPPS curriculum and all the work you've done too for our community here. So thank you so much for joining us. This is being recorded and we will share with everyone after the webinar along with the slides again, so everyone will have access. So thanks everyone, and we hope to see you next month for part 3.
Thanks everybody.
Thanks everybody.